Welcome to Real Hope, a monthly video series by the Mississippi Department of Mental Health to share more about specific services and supports that are available in our state to help our friends, family members, and neighbors who have a mental illness, substance use disorder, or intellectual or developmental disability. Each month in our Real Hope series, we will dive a little deeper into a specific service or support. This month, we are highlighting mental health first aid training for Mississippians. The Mississippi Department of Mental Health is proud to offer and help coordinate mental health first aid trainings across the state for educators, parents, law enforcement officers, and communities in general. This evidence-based early intervention training program teaches Mississippians about mental health and substance use challenges. If we saw someone having a heart attack, we'd start CPR, or at the very least call 911. But too few of us would know how to respond if we saw someone having a panic attack, or experiencing depression, or thoughts of suicide, or if we were concerned that a friend or coworker might be showing signs of substance use disorder. Mental health first aid takes the fear and hesitation out of starting conversations by improving understanding and providing an action plan that teaches people to safely and responsibly identify and address a potential mental health or substance use challenge. It also teaches how to connect someone with the resources available in Mississippi. When more Mississippians are equipped with the tools to start a dialogue and know how to connect people to resources, more people can get the help they need. Mental Health First Aid is an 8-hour training that teaches a 5-step action plan with skills, resources, and knowledge to help a person in crisis connect with appropriate professional, peer, or self-help care. Participants learn the unique risk factors and warning signs of mental health problems, builds understanding of the importance of early intervention, and most importantly, teaches people how to help someone in a crisis or experiencing a mental health challenge. The Mississippi Legislature passed the Mississippi Collaborative Response to Mental Health Act in 2023, requiring mental health first aid training for all law enforcement officers. The better prepared officers and staff are to respond effectively and appropriately, the more likely the interaction will be a positive one. Tools like mental health first aid gives officers the skills to recognize and respond to immediate crisis and allows them to stabilize someone and de-escalate the crisis. Law enforcement in Mississippi have said the training helped them better understand how effective they can be when approaching a person who is in a mental health crisis. Mental health first aid for public safety was specifically developed to learn how to assist and support their peers or individuals they encounter in the field. Public safety professionals encounter high levels of stress, trauma, and critical incidents, which can take a toll on their mental health. The training promotes open dialogue, reduces stigma, and encourages public safety professionals to seek support when needed. After completing the course, 92% of the participants reported that they will very likely use the skills learned to connect a person experiencing a mental health or substance use crisis to appropriate health and resources. In FY24, 25 trainings for public safety were held across the state, with more than 400 officers trained within 49 different law enforcement agencies, with more to come in 2025.